Hi everyone, it's Vanessa Gorman here, and I'm honoured to put my name forward for the ENA President-elect for 2026. So, at my core, I'm a nurse, but I'm also a mum. I'm a new grandma, a wife, a sister, and a daughter. Those roles have shaped who I am both as a person and as a leader today. They've taught me resilience, compassion, empathy, and the importance of genuinely caring for people during both their most challenging and most important moments. I chose nursing because I wanted to make a difference in the lives of others. And emergency nursing was a true calling for me. It gave me the opportunity to care for people at their most vulnerable time, to advocate for patients and families, and then support teams working in incredibly complex and challenging and demanding environments. Yes, over time, my career has evolved into executive leadership, governance, and health system strategy, but my purpose has remained the same: caring for people and creating environments where both patients and staff, nurses, can thrive. Now, I've had the privilege to serve on the board for over 5 years, and I've contributed to governance and strategy planning and financial stewardship even when times were hard. And I've helped, I hope, to strengthen the future direction of our great organisation. This year, I just completed, in the last week or so, my Doctor of Nursing practice in executive leadership. And I hope that shows you, the members, my commitment to advancing our profession through evidence based leadership and collaboration. As a leader, I believe in authenticity, collaboration, courage, and service. I believe leadership is about bringing people together, listening carefully, and ensuring every member feels represented, valued, and supported. For me in 2026, the campaign is simple. We lead with purpose and we care without borders. Thank you for your support. I would be truly honoured to serve you, our members, and ENA as our next President-elect. So I'm seeking the President-elect position because I genuinely believe this is a pivotal time for emergency nursing and ENA as an organisation. Healthcare systems globally are facing increasing complexity, workforce pressures, rapid technological change, and growing demand for emergency care services. During periods like these, professional organisations like ENA play an incredibly important role in advocacy, leadership, education, and supporting the future sustainability of our profession. I believe I bring a unique combination of frontline emergency nursing experience that is still current, executive healthcare leadership, governance capability, and strategic thinking that positions me well to help lead ENA into the next chapter. Throughout my career, I've led complex healthcare operations. I've managed large teams, I've managed large budgets, I've driven organisational change, and I've worked extensively in stakeholder engagement and system reform. Those experiences have reinforced for me the importance of collaborative leadership, strong governance, financial stewardship, and remaining focused on the needs of the people we serve, you, our members. Importantly, I'm not seeking this role for title or recognition. I'm seeking it because I care deeply about emergency care and emergency nurses, our profession, and the future direction that we're going. I want to help continue to strengthen ENA's influence nationally and internationally, to support leadership development of our workforce, to remain innovative, financially sustainable, and member focused. I believe strongly in building future leaders. One of our greatest responsibilities of leadership is creating opportunities for others to grow, to contribute, to lead and shine confidently into the future. I'm fully committed to the responsibilities of this role and would be honoured to continue to serve you, our members, and our profession as your President-elect. I believe one of the biggest challenges facing emergency nursing in 2027 will be balancing rapid technological advancement, including artificial intelligence, yes, I said it, and digital healthcare transformation, with equitable, safe, and human centered patient care. Technology is rapidly changing healthcare. We are already seeing increased use of AI, predictive analytics, digital decision support systems, and virtual models of care right across the globe. These innovations have enormous potential to improve patient outcomes, operational efficiency, and access to care. However, there are also important risks and challenges. One of the greatest concerns is ensuring technology enhances healthcare rather than creating further inequity. vulnerable patients, rural and remote communities, culturally diverse patients, and those with limited digital literacy must not be left behind as healthcare evolves. At the same time, emergency nurses must have a strong voice in how these technologies are designed, implemented, and governed. Nurses are not simply users of the technology. We are critical leaders in ensuring innovation remains safe, ethical, evidence-based, and patient-centred. I believe ENA has an important leadership role to play in this space. ENA can continue advocating for emergency nurses to be actively involved in healthcare, innovation, policy discussions, while also supporting education, leadership and development, and digital capability across the profession. Most importantly, ENA can help ensure that as healthcare evolves, we do not lose the human connection that sits at the heart of emergency nursing. Technology will continue to change healthcare, but compassion, critical thinking, advocacy, and human judgment will always remain central to what we do as emergency nurses.